Dr. Garate, let's talk about child orthodontics. What's important there?
Well, first of all, the important thing is that most parents think that their children should get braces when they're, in their teenage years. While that is a big important thing that a lot of parents consider because they see their children going into middle school, junior high, high school, and they don't want their children as adults to have bad teeth. The truth of the matter is that children, we have to see if they're growing properly. The proper positioning of teeth is going to determine how our face looks, how it grows. A lot of parents don't relate how the bite is, how the teeth are in the position with each other on the jaw to the children's growth. So catching growth problems at an early age, the sooner that they're caught, we can correct the way children are growing. Sometimes those children, it just involves placing some type of appliance that needs to be worn for a short period of time. Sometimes the case is more complicated. But overall, what I've explained to parents most of the time is that if the growth of the child is where it needs to be, there's a good possibility that sometimes those cases will not need conventional braces. In some cases they will. But in a lot of cases, if we follow the growth pattern properly for the child, we're able to avoid costly and invasive surgeries that a lot of people nowadays take as normal. There's a lot of children that start braces when they're 15, 16 years old, and by then a lot of their growth in their jaws is already out of alignment, and they end up needing surgery to move their jaw forward or back, or their jaw forward or back on the bottom, or vice versa. And those are very costly and they're very invasive surgeries. So a lot of those can be avoided if we are able to guide the children's growth.
I see. So at what age should a mom really kind of like go to somebody who does orthodontic service with the child and start checking when what is needed? Because it may not be needed right away, but it should maybe sometimes be observed.
Yes. I would say, as parents have their children and their teeth are coming out, it's not very observable at a very young age, but at about 5, 6, 7, 8 years old, in that range, we can start seeing the discrepancies. We can start seeing children that suck their thumb. We can start seeing children that are biting on things. We can start seeing children that they don't look even on both sides of their face, little subtleties. And I've had many situations where I show parents how their children's face is not growing. And these are beautiful children. I mean, they have all the nice features, but they look at their child and it's like, oh my God, you're right. My child's lip is dropped down. This is too forward, too back. One side looks dug in, and they don't really look at their child from a growth perspective. So it's very important in the age between 5 and 8 to start looking at those different things to see how everything's turning out. It doesn't necessarily mean that treatment needs to be started right away. Sometimes those things self-correct as we get rid of those habits, but each case is different. The important thing is that a professional looks at it and evaluates it for the need for treatment or for just following up and watching the growth.
Got it. So, all right. Again, like you said, in a couple other of those segments that, prevention. So this falls under prevention. Start early so that afterwards you don't have to repair such a huge problem. Beautiful.
That is correct. Yes, that's correct.
Beautiful. You almost want me to go to the dentist.
Yes, you should.
I bet that.
And I don't say it. I'm just saying, you need to make sure you continue going to the dentist.